Are you struggling to recall the plethora of signs and symptoms of hyper and hypoglycemia? Are you finding it tedious to keep up with all the lab values for diabetes mellitus? Well, if you are, you're in the right place. Welcome back to the channel, everyone. Nurse Jared here, and this is the second installment of our lecture series on diabetes mellitus. In this video, I'll take you through my comprehensive approach to learning the signs and symptoms of hyper and hypoglycemia, complete with diagnostic criteria and effective study techniques to ensure you not only grasp, but also retain the essential information. I'll begin with the lab values and then systematically walk you through the signs and symptoms of both hyper and hypoglycemia. So let's dive right in. When it comes to our health, understanding the signals our body gives us is crucial. First, we'll dive deep into understanding how diabetes is diagnosed. There are several ways to diagnose diabetes, and often these tests need to be repeated on a second day for a clear diagnosis. Testing should ideally be conducted in a healthcare setting, such as your doctor's office or a lab. Sometimes, if your blood glucose level is high enough, a single test may suffice. First up, the A1C test. The A1C test checks your average blood glucose over the past few months. The great part? No need to fast or drink anything special for this test. Diabetes is diagnosed when A1C levels are 6.5% or higher. The normal range for A1C is less than 5.7%. It would be considered pre-diabetes if the A1C was 5.7% to 6.4%. The diabetes range for A1C is 6.5% or higher. Next up, we have the fasting plasma glucose test. This is usually done in the morning after fasting for at least 8 hours. Diabetes is identified at levels of 126 or higher. The normal range for this test is going to be under 100. The pre-diabetes criteria would be 100 to 125, and the diabetes range is going to be 126 or higher. Moving right along, we have the oral glucose tolerance test, or OGTT. After a sweet drink, your blood glucose levels are checked 2 hours later. Diabetes is flagged at levels 200 or higher. The normal range for this test is going to be under 140. Pre-diabetic range is 140 to 199, and diabetes is going to be 200 or greater. Lastly, there's the random plasma glucose test, taken anytime you show severe diabetes symptoms. Diabetes gets the green light at levels 200 or higher. But what about pre-diabetes? Well, pre-diabetes is just the phase before type 2 diabetes, when your blood glucose levels are higher than normal but not enough for a diabetes diagnosis. Often called impaired glucose tolerance or impaired fasting glucose, it can put you at a higher risk for type 2 diabetes and cardiovascular disease. The tricky part is that prediabetes often doesn't show clear symptoms. So if diagnosed with prediabetes, it's crucial to get checked for type 2 diabetes every 1 to 2 years. Keep these figures in mind for prediabetes diagnosis. An A1C of 5.7 to 6.4%, fasting blood glucose of 100 to 125, and an OGTT of 140 to 199. Alright, now that we're familiar with the lab values to monitor, let's shift our focus over to the signs and symptoms of hypoglycemia. What's up, everyone? Let's pick up right where we left off in part 1 of our diabetes lecture series. Now that we've got an overview of what's going on with diabetes mellitus as far as glucose regulation, we've got our endocrine pancreas, beta cells, alpha cells. We know a little bit about type 1 and type 2 diabetes and their etiologies, and our acute and chronic complications. So in this part of the series, we're going to start off with the diagnostic criteria and then move into the clinical manifestations. So let's kind of add the diagnostic criteria up at the top, because in order to treat diabetes mellitus, we need to know for sure that that's actually what we're working with. So in order to do that, the doctor needs to go through diagnostic criteria, and we as nurses needed to know what that looks like. So let's kind of come over here on the top part here, and let's put in our diagnostic criteria, and this will be blood tests. So let's go ahead and add in a little blood drop up there. With the diagnostic criteria, the physicians are going to use 4 different blood tests to be able to make a diagnosis. So let's go ahead and add those out to the left of our diagnostic criteria. Physicians are going to be looking at 3 different ranges for these lab values. They'll fall into the categories of normal, pre-diabetes, or diabetes. So let's chart those here on our mind map, and then we'll set the values for each of those. So let's chart these 3 ranges for each of our blood glucose tests. All right, that looks kind of nice. Now let's go ahead and denote our diabetes range with a, rectangle. And let's make it a bright red. All right, moving right along, we've got our random. Moving on down the list, we have A1C. The A1C test is going to show us how well blood glucose has been regulated over the last 3 months or so, due to this being approximately the lifespan of a red blood cell. So there's nothing special that you have to do with this test as far as fasting or any of that. So let's chart out our ranges here. So that 6.5 or higher is really going to be that number physicians are looking at to get that diabetes diagnosis with the A1C test. We'll just go ahead and put a rectangle box there and then indicate that that's the diabetes range. We'll go ahead and make that the bright red as well. All right, moving on to our last test, which is our oral glucose tolerance test. Let's go ahead and denote our diabetes range with our rectangle and being bright red. Now that's going to take care of our diagnostic criteria, and let's kind of move this up with our glucose regulation topic. So now that we've got an overview of diabetes mellitus and the diagnostic criteria, now let's take a look at the clinical manifestations of diabetes mellitus and what to really be on the lookout for when we're caring for these patients. All right, so let's pull up Anki and pick up from where we left off at in part 1 of the series. Now that we've got Anki pulled up here, we're going to go ahead and go to our diabetes mellitus deck. So as you can see here, we still have our 32 new cards that we made from part 1 of the series. So let's go ahead and hit add and continue from where we left off. So we're going to stick with the closed deletion type cards and then make sure, verify that we're in the right deck, and we are. And let's go ahead and add in those tags that we had from part 1. So we'll add in diabetes, DM, and then also I think we had in glucose. I'll just double check that. Yeah, diabetes, DM, and glucose. To start off, let's add to the top of our card the subject we're working on, or the topic rather. And I'm going to go ahead and add that candy in up top. And on Windows, it is that Windows plus or Windows period key. All right, I'm going to double click all that and then hit Control B and bold that. And right here, I'm going to actually put in, because let's start off by making cards for the diagnostic criteria. So let's go ahead and put diagnostic criteria right underneath this diabetes mellitus, since we're going to start off making these lab value cards. And I'm going to go ahead and italicize that and then also put that in red to kind of signify that we're dealing with the diagnostic criteria. And you know what, just to be even more aesthetic, add that little blood droplet in. And I'm going to make sure that we have our toggle sticky selected on both the text field and our back extra field. And in the back extra field, I made a little chart in Notion. So let me go ahead and just show you real quick the Notion page I made for these lab values. I made this chart based on all the data from the diabetes.org website from the ADA, and this is what I came up with. So this will be the chart that I'm going off of with the diagnostic criteria, and then also this is what I'm going to paste in and put on the back side of those cards. Just that way, whenever we flip them over, we can still see the full chart. And then I'm also going to show you how to make an image occlusion card using this chart in just a moment. Let's start the diagnostic criteria cards off with, can a diagnosis be made off of one test? And the answer is generally no. So let's just make a general card here. So let's put in, can a diagnosis be made off of one test? So generally no, tests must be performed on 2 separate days to make a diagnosis. And we'll go ahead and just close all that off and make that our answer part. So can a diagnosis be made off of 1 test? And that is going to be generally no. All right, let's add that in. So to begin with, let's start off with our fasting glucose range. What is the normal range for fasting blood glucose? That is less than 100. Next we have what is the fasting blood glucose range that is indicative of prediabetes, and that range is the 100 to 125. And the last range we're looking at for our fasting blood glucose is the diabetes range, which is 126 or higher. I'll go ahead and select all that, Control-Shift-Center. That's going to give us what is the fasting blood glucose value of diabetes. I will just go ahead and italicize that and Control-Enter again. For our next test, we have the random or casual blood glucose. And this one's just going to be indicative of diabetes, and that's going to be at 200 or higher. So I'm going to go ahead and bold that text, and then we'll italicize that. Then I'll double click here and Control-Shift-C, and I think that'll be a good card for our random blood glucose. Let's add that in. Next up we have the normal range for A1C. Bold that. And we got 4 to 6. Enter that. Next up we have the prediabetes range for our A1C, which is going to clock in at 5.7 to 6.4%, which will put us at prediabetes. And then our last range for A1C is going to be our diabetes range. That's going to be at 6.5% or higher. I'm just going to bold this, and I'm going to italicize this. And last but not least, we've got our oral glucose tolerance test. I'll embolden that, and this is going to be the normal value at under 140. So we'll mark that. What oral glucose tolerance test range is indicative of prediabetes? And that's going to be our 140 to 199. Let's just italicize that there. Boom, and now let's get our last one in for the diabetes range, which is at 200 or higher. All right, now that's going to give us specific cards to help us remember each of those ranges for each of those tests. Now let me show you how to make an image occlusion card using that table I made in the event that you would rather just use the chart and blot out the lab values. So I'll show you how to do that. All right, let me show you how to make that image occlusion card. So let's take our chart here and let's hit Windows Shift S. And we're going to go ahead and take a screenshot of our chart here. Now that we've got that copied, let's come up here to our image occlusion tool and we'll hit that button there. Let's expand this full screen and come down here and hit Fit to Canvas. All right, this is going to expand that image to fill out those borders. And what I'm going to do here is make sure our rectangle tool's highlighted. And now I'm going to pick this orangish peach color down here. And what I'm going to do is underneath each of these ranges, I'm just going to drag this to expand the length of this chart and make that a highlight. And then for our random casual, I'll make this a card. And then I'm going to make our A1C values a card. And then down here on the OGTT values, I will make that. Instead of hitting hide one, guess one, I will select the hide all, guess one. And now you can see I've got 4 cards added down here to our deck. Now we can just go in and test ourselves over these lab values within all these ranges at one time and looking at the chart. So that's just another way of doing it. I like sometimes having the individual cards and then also the image occlusion card just to get a different look at it. So it might be a little overkill, but you should be able to fly through these cards pretty quick once you get the hang of it, and it won't really bog down your time too much. So what you could do in this sense that you've made both the individual cards and the image occlusion card, You could go ahead and start hitting easy on one of the two. That way you see one less frequent than the other. But, totally up to you. Hypoglycemia. As we discussed in part 1, the primary players in regulating blood glucose levels when they fall below normal are the alpha cells. Hypoglycemia occurs when blood glucose levels drop below approximately 70. Once glucose levels dip below this threshold, the body initiates a rapid response to rectify the situation. Now, the central nervous system relies on a constant supply of glucose, and the brain in particular has limited glycogen stores and cannot produce glucose itself. When blood glucose levels plummet, the body activates its response mechanism. Ordinarily, insulin secretion decreases, glucose utilization is curtailed, and glucose production increases. Our trusted companions, glucagon and epinephrine, step into action. They stimulate the liver to break down glycogen and convert protein into glucose. Due to heightened release of epinephrine or adrenaline, early signs and symptoms arise as a result of automatic nervous system stimulation. We'll delve into those shortly, but it's essential to grasp the physiological processes at play to understand these clinical manifestations better. With that in mind, let's examine the mental status changes associated with hypoglycemia. Individuals with low blood glucose levels often become nervous or irritable and possibly confused. Their behavior may deviate from their usual demeanor. During such times, it's crucial to exercise patience and offer reorientation as necessary. Kindly inform the patient that you will check their blood sugar and assist them in feeling better soon. In severe cases, if glucose levels drop significantly, the client may experience seizures or worse, fall into a coma. Now, onto integumentary manifestations. You may have heard the old adage, if they're cold and clammy, give them some candy. Well, that saying remains an excellent mnemonic to this day. As mentioned earlier, the surge in adrenaline triggered by low blood glucose levels leads to blood vessel constriction and sweat gland activation. Consequently, individuals may appear cold and clammy, accompanied by pallor, giving them an unhealthy pale appearance. When it comes to the respiratory system, there's nothing really to write home about with hypoglycemia. Now, let's explore a comprehensive list of the general clinical manifestations of hypoglycemia. Because the body lacks sufficient glucose to fuel its cells, clients often present with weakness and fatigue. Additionally, reduced blood sugar levels can impair brain function, resulting in headaches and blurred or double vision, which can increase the risk of falls. Clients may experience an intense, insatiable hunger referred to as polyphagia. This heightened appetite arises partly because the brain relies heavily on glucose as its primary energy source. A drop in glucose levels triggers signals that boost appetite, encouraging individuals to eat and raise their blood sugar levels. Epinephrine release during hypoglycemia contributes to tachycardia, shakiness, and tremors. These symptoms often accompany the condition. In clients with diabetes, a common test is a urine analysis to detect the presence of ketones. Typically, ketones are not found in cases of hypoglycemia. This absence can be attributed to the body's effort to elevate blood glucose levels by releasing stored glucose from the liver, glycogenolysis, or by producing glucose from alternative sources, gluconeogenesis. Ketone production primarily occurs when the body struggles to use glucose effectively, a hallmark of hyperglycemia. All right, diving into those clinical manifestations. As we know now, the clinical manifestations for hypoglycemia are going to start kicking in around that less than 70 range. So let's go ahead and drop us down and then make hypoglycemia a thing. And let's go ahead and make it known that it's less than 70 is when that's going to start occurring. Now this is going to start really getting into the pancreas of our material. They're going to get all cold and clammy, so let's make it this kind of icy blue color. And then let's probably put like I don't know, maybe that shape. All right, and just to note them, let's kind of hit the two hormones that we're really looking at with hypo, just as kind of a side note. We've got glucagon coming on the scene, and then also epinephrine. Let's also put a little spark here or whatever. Let's just put that there because that's going to kind of remind us of that autonomic nervous system stimulation. And that's what's going to kind of cause that clamminess and that tachycardia and tremors and all that kind of stuff. So we'll put that there just to signify what kind of reaction we're getting from our nervous system. Let's start off by looking at our mental status changes. And I'm just going to put a brain here. And let's branch this bad boy off. I'm going to paste all our fields in here. And let's change confusion and nervousness over to these, kind of highlight these more. Let's put those like that. That's because you're really going to kind of notice those things first, especially if you've been taking care of somebody for a long time. So if you begin to see somebody you've been taking care of start to get confused or nervous and kind of deviate from their baseline, if they have diabetes mellitus, that's a really good indication that those blood sugars are starting to bottom out. So that's the mental status. All right, now let's do our integumentary, also known as our skin. And you know what? I'm just going to put an arm here and denote that as our skin. And as we know, that's going to be our cold and clammy. Give them some candy. So as that autonomic nervous system is stimulated by that epinephrine, it also is working on those sweat glands. So that's where you're going to get that real cold and clammy. So give them some candy and let's get that blood sugar up. So I came up with my own little silly saying to try to top the cold and clammy, give them some candy mnemonic. That was, when I'm feeling low, I go to Cool Clams Parlor. I don't know. I used to be a bartender, so... But you know what? I'm going to add it in here anyway, just because I think I kind of like it. Let's just put in the candy parlor. I don't know. I don't know if that's better than the cold and clammy, give them some candy. But maybe that'll stick in your head too. All right, there's nothing really to write home about on the respiratory with the hypoglycemia. Now let's add in just those general signs and symptoms. And then one last thing with our hypoglycemia is that we're not going to see any urine ketones with hypoglycemia. So let's add this up here too, that we're just negative for ketones. Let's make it yellow for urine. Okay, I think that looks pretty cool. Now we have an overview of diabetes mellitus, our type 1, type 2, we've got our complications, we have our diagnostic criteria, and now we can start seeing what the patient's going to present with when the blood sugar levels drop below 70. What kind of hormones are going to kind of kick in, and then we're going to have no ketones, and then our mental status, our manifestations here. So broadly, these are our classic signs and symptoms of hypoglycemia. All right, jumping back into Anki. So let's just make a couple cards to remind us So let's just make a couple cards now reminding us of the glucose level for hypoglycemia and those two counter-regulatory hormones that kick in. So let's add in, at what approximate glucose level does hypoglycemia occur? Let's just make this less than 70 G per DL. And let's close that off. All right, at what approximate glucose level does hypoglycemia occur? I think we can just embolden that. And that's going to be less than 70. All right, Control-Enter, add that. What two hormones step into action to stimulate the liver when blood glucose levels plummet? That's going to be our glucagon and epinephrine. I'm going to double-click, Control-Shift-C. And I'm going to make real note of that. What two hormones? And we're going to be able to see our slide and below. And also be sure to add any type of supplemental resource information down here in this back extra field that can help you remember this information better while we're going along. And just remember, like, these decks will be available. All right, now I'm going to hit Control-Enter, add that to our deck. And just to add in one more card to help remind us of the epinephrine, I'm going to add in the Due to the release of which hormone do signs and symptoms of hypoglycemia arise from autonomic nervous system stimulation? And that's going to be none other than epinephrine, or as some may call it, adrenaline. Double click that, Control-Shift-C, and close that off. And I'm going to go ahead and bold hormone to signify what we need to answer. Moving right along, now we've got the clinical manifestations of hypoglycemia. So what are the mental status symptoms in hypoglycemia? And you know, I'm going to go ahead and add in a little brain emoji there. Now on our slide here, we have 6 pieces of information. Now on our slide here, we had 6 pieces of information. I'm going to take a screenshot of our slide over here and add it in this back extra field. Now this is where you can kind of start getting creative and coming up with funny sayings or anything to help you remind you of these chunks of information. Now what I did here is I created this little mnemonic based on the first letter of each of these words. The more kind of funny you can make it or make it stick in your head, the better. So I came up with never irritate Confucius, personally change seasons coded. Now that doesn't mean anything at all, but it does to me because I spent time creating that and looking at these words. So if I can say that phrase now in my head, I can go through and recall each 6 of these terms here. Or I could make 2 cards and just close out 3 of these and then do the other 3 on the back. It's really kind of all how you want to approach things. I think if you can come up with something like that to make it easy to go ahead and rattle off 6 terms, that's cool. If not, you could do a close here, here, and here. So you could do 1, 2, and 3, and then change this to 1. And then you could come here and make just 1 card here and a second card here. Or you could leave it like that, and you could also place, and then so you could place that right there underneath, and that could remind you of both, and you could still leave the 2 cards. So either way you want to do that, that's totally fine. Let's just make it 2 cards here. We'll have the first card being these top 3 and the second card being these bottom 2. And then, but we'll still keep the never irritate Confucius, personally change seasons coded. And if we wanted to just kind of, this is a little bit superfluous, but I'll just go ahead and bold these since this deck is available for download anyway, and you don't have to take the time to do this. You know, that works. Or you could also just put this on the back extra field if you didn't want to see it up here, but I think it would be better to see it on the front side, that way it could spark your memory. Or if you were trying to, whatever. I think it would be better on the front side here. All right, so let's go ahead and add that there. Let's move on along to our integumentary symptoms. Now let's take a screenshot of that integument slide and then add that below here. All right, let's make a card about the integument. What are the integument clinical manifestations? And we can also put down here cold and clammy. Give them, well, no, we don't want to put that there. So because there's only really 2 things to look at here, we'll just put cool, clammy, and pallor. And we'll just close those off. And then let's add our 2 sayings here as well. And we need to specify that it's hypoglycemia that we're referring to. There's a big difference between hyper and hypoglycemia as far as the skin goes. All right, so I think that looks good for our integument. And we'll hit Control Enter, add that. Now there's nothing going on with the respiratory really. Now let's make some cards over the general clinical manifestations of hypoglycemia. Let's start off by making a broad card that encompasses all the signs and symptoms. And then we can break off and then make a couple specific cards relating to a few different ones that will help us really solidify that knowledge. Now let's grab a screenshot of our PowerPoint and the rest of our symptoms here. That's going to show us that, just to have a visual that can maybe link back to how we studied these, or if you get a screenshot of your textbook, throw that in there as well. And then also we'll put our mind map back on the back when we're done with it. I say general clinical manifestations, that's just a general term. This is just kind of the rest that were outside of those other ones we just covered. And I'm going to italicize that, and we'll put this in bold. I'm going to put these hyphens in front of here too. We've got 1, 2, 3, 4, 5, 6, 7. So that doesn't divide evenly, and that's going to put us around either 3 pieces of information and a 4. I think that's fine. These are relatively pretty easy to remember, I think, with everything we know about diabetes now. So let's kind of lump this in. Let's just do weakness, fatigue, and blurred or double vision all together, because that all kind of has to do with, you know, when I think of those, I can think of the brain and the mind. You're weak, you're tired, you're getting that double vision, the blurred vision. And so we'll make that one card. Polyphagia, our tachycardia. Now you could leave these emojis not closed in and give yourself hints, but I think that it might be too good of a hint. If you left that out, you'd probably know immediately and not test yourself on it. So let's go ahead and close the emojis off, just so we don't give away the answers. So we'll draw this 2. We'll make these 2. All right, now we got 2 cards here. Top 3 and these bottom 4. I think that'll be a good card, or good 2 cards rather. So let's go ahead and hit Control Enter. Now let's make a few specific cards kind of relating around those, just so we can kind of see it in a different light. So I've already got some made here. Let's take a look at this one. When the body lacks sufficient glucose, what general symptoms related to energy and vision might the client present with? And that's going to be weakness, fatigue, headaches, blurred or double vision. And then we'll keep this PowerPoint card below here for an overview when we flip. And then also add in anything else you'd like to help you remember the information. And we'll add in this one. What term describes the intense hunger? And I want to bold that because that's extremely important. So when you see that on a test, this is usually a really big giveaway that this is hypoglycemia, when you've got that hunger. And I really struggled in nursing school to differentiate the hunger, all the polys. It kind of got jumbled up in my head quite a bit. But I was just in the early phases of developing this system back then. Now, by doing this, you can really separate it out and really hone in on those different polyphagia, dipsia, urea, all that good stuff. So what term describes the intense hunger often experienced during hypoglycemia? And that is polyphagia. So anytime you see phagia, think of swallowing in your throat, like dysphagia. At polyphagia, that dysphagia is going to give it away. This is going to be good too. It's always good to remember the epinephrine. So what symptoms arise due to the release of epinephrine during hypoglycemia? And that's going to be that tachycardia, shakiness, and tremors, as I'm sure we've all felt at one point in our lives. Maybe just not due to hypoglycemia. Maybe you're experiencing this because of your upcoming exam. I know I sure was. And last but not least on our hypoglycemia is our ketones. And we're not going to really see that. So let's just ask ourselves a simple question here. Our ketones typically, let's keep that italicized because that's not always the case, but for the most part, ketones are typically not found. So, no. Let's drop that down. Double click and Control Shift C. And that, my friends, is hypoglycemia. And let's move on to hyper. And actually, we need to change the picture down here. So I'm going to show you how to do that real quick since I didn't swap the back extra field. Let's go into Browse. So now that we're in Browse, I'll show you a quick search feature here. So we'll go to ketones. So we'll search ketones. So now that we search ketones, we found our card here. Let's go into the back extra, delete that, and I'm going to take a screenshot of our PowerPoint. I'm going to add this in the back extra field. So now when we practice this card, this is the front and this will be the back. So there we go. Just wanted to clear that up. Hyperglycemia. Pancreatic beta cells play a pivotal role in regulating blood glucose levels by releasing insulin into the bloodstream. However, in diabetes, insulin becomes ineffective or cells develop resistance to it. Before delving into the clinical manifestations of hyperglycemia, it's crucial to understand when to expect these symptoms based on the laboratory values. Hyperglycemia occurs when blood glucose levels exceed 200. If left unaddressed, elevated glucose levels could lead to diabetic ketoacidosis, occurring at levels greater than 300, or HHS, occurring at levels greater than 600. While textbooks typically emphasize the classic symptoms of hypoglycemia concerning mental status, it's worth noting that the severity of mental status changes can vary from alertness to coma in cases of severe hyperglycemia, which we won't cover in this video. Hot and dry, sugar high. You might already be familiar with this saying, and it's due to the flushed and dry appearance that individuals with hyperglycemia often present. Like someone traveling across a desert, these individuals become dehydrated and crave water like crazy. This happens because glucose is osmotically active, meaning it pulls water along with it wherever it goes. As the kidneys filter the blood and eliminate this excess glucose, it pulls water along with it, resulting in dehydration. This increased urine output is known as polyuria. Elevated blood glucose levels, which create hyperosmolar blood, stimulate the osmoreceptors in the hypothalamus, triggering an increase in thirst. The idea is that consuming more fluids will replenish the volume lost through polyuria. This heightened thirst is referred to as polydipsia. Due to the significant fluid shifts and acid-base imbalances during hyperglycemia, clients may experience nausea, vomiting, and abdominal pain. With glucose unable to enter the cells to generate sufficient ATP, or energy, the body resorts to alternative metabolic sources for fuel, namely lipolysis and proteolysis. Without diving into the biochemical details, let's focus on lipolysis for a moment. When glucose can't be utilized by cells, the body starts breaking down fatty acids from adipose tissue into molecules called fatty acids and glycerol. These fatty acids can further metabolize into molecules known as ketones through a process called ketogenesis. In essence, this is one of the alternative metabolic pathways the body uses to generate fuel in the absence of glucose. The key takeaway here is that it creates a highly acidic environment in the blood, leading to metabolic acidosis. As hydrogen ion levels rise and the pH drops in the bloodstream, the lungs kick in to correct this imbalance by initiating deep and rapid breathing to expel excess carbon dioxide and restore pH to normal. When respiratory efforts become uncontrollable in response to metabolic acidosis, the individual experiences Kussmaul respirations. These rapid deep breaths may emit a fruity or acetone-like odor. This odor stems from acetone, a specific ketone produced during ketoacidosis, contributing to the breath's distinct smell. This fruity odor serves as a clinical clue for healthcare providers to identify the underlying condition of the patient's symptoms. Naturally, when a urine analysis is conducted on these patients, ketones will be detectable due to the utilization of lipolysis for energy rather than glucose. Okay, next up we have hyperglycemia. So let's go ahead and add that right over here. Now to be symmetrical, let's go ahead and add this to our, I guess was that a rhombus, trapezoid? It's been a long time since I've done geometry. So with hyperglycemia, we've got that dry, flushed skin. So maybe we'll just keep this color. All right, so hyperglycemia occurs at 200 and above. So let's kind of do what we were doing over here. The integument is none other than that warm, flushed, dry skin. That's a really classic sign of hyperglycemia because they're going to be urinating so much Because of the polyuria, they're urinating so frequently, and it's causing all this dehydration. So that's what's causing the thirst and also this flushed, dry skin appearance in hyperglycemia. So we'll denote that there. We do have some notable respiratory signs in hyperglycemia. So let's go ahead and add those lungs here. All right, there's those. All right, there's the respiratory symptoms. And let's go on over to our broad clinical manifestations now. Now here's all the polys again and symptoms. And we'll make specific cards going over each of these so we don't get them confused, which I certainly did throughout my nursing school. Because they all start to run together, it seems. And this abdominal pain kind of just comes along with that nausea and vomiting as well. And last but not least here, let's go ahead and add in our urine test. Now let's add in that ketones will be present here with hyperglycemia, more than likely. And we'll denote this with the rectangle and the yellow tag for urine. There we go, I like the look of that. Alright, so now we've got a beautiful contrast of the hyper and hypo on both sides of the spectrum here. Now let's hop back over to Anki and finish up our cards for part 2. Alright, now switching gears, let's come down here and take off our hypoglycemia and add in hyperglycemia. Alright, perfect. Let's start off with our lab value cards and come over here. We'll take a screenshot and add that in below here on our back extra field. Now let's make a couple cards over our values so we remember those. At what blood glucose level does hyperglycemia occur? And that's going to be above 200. And we'll get that closed deletion there, above 200. Moving on down to our mental status changes for hyperglycemia. I'll add in our PowerPoint slide. How can the severity of mental status changes in hyperglycemia be described? And that's just that it varies from alert to coma. Be sure to check with your curriculum to see if there's anything more in depth on these. I know when I was going through nursing school, this was pretty much what was covered. It was really the hypoglycemia that was really focused in on the mental status changes with that confusion and the irritability and nervousness and the personality change. So look further into this, but this is just what we kind of covered in the textbook in my nursing school. Do verify with your curriculum to make sure that there isn't anything that's been added. But do verify that there isn't anything specific that your instructors are looking for you to know, because this does vary so widely. But like I said, it was hypoglycemia that we really honed in on the mental status changes in hypoglycemia. But anyway, nevertheless, I'll add that in. Moving on to the integument, the hot and dry sugar high. Let's just add that in as a card. What saying describes the appearance of individuals with hyperglycemia? So let's add that as a card. What saying describes the appearance of individuals with hyperglycemia? And that hot and dry sugar high is our go-to phrase. And that's going to signify, I'm going to drop down here and put our flushed dry skin. And then I'll make this just one big close right here. All right, cool. Hot and dry sugar high. And we'll add that in. As a matter of fact, let's come back over to our mind map. I forgot to add that in here. Let's add in one more card on this skin. Why do individuals with hyperglycemia appear flushed and dry? And that's because of that dehydration we were talking about, caused by the increased urine output, the polyuria, as glucose pulls that along with it when it's being filtered out of the kidneys. So we'll just go ahead and note that, just so we kind of know why this is going on and allow us to remember that a little bit more easily. So add that in. And let's move on to our respiratory clinical manifestations. And let's talk about the Kussmaul respirations. And let me grab a screenshot of our respiratory here. Looking at this, how do the lungs respond to metabolic acidosis caused by the elevated ketone levels in the blood? This metabolic acidosis is all due to that hyperglycemia tapping into those alternate metabolic pathways for fuel That's why we're going to be seeing those. So we'll make that a card. I'm going to mark metabolic acidosis in red text just to signify we're acidotic and we need to correct this. Now let's quiz ourselves on that distinct odor we're going to get along with those Kussmaul respirations and that metabolic acidosis. And we're going to get that fruity acetone-like odor. So what distinct odor might be detected in the breath of someone with ketoacidosis? And that's that acetone fruity odor. And let's put that in yellow. Let's add a fruit down here as well. And let's add a fruit as well. And Control Enter to add that in. And let's focus more in on that metabolic acidosis and quiz ourselves a bit further. And one more question over the respiratory function. What specific type of breathing does an individual experience in response to metabolic acidosis from hyperglycemia? And that is our Kussmaul respirations. And let's put it as rapid, deep. Because these respirations are going to be out of their control. They're going to be breathing like crazy, and they might be over in that orthopnic position, just depending. All right, Control Enter to add that in. Now let's move over to our general clinical manifestations. Grab a screenshot here of our PowerPoint, add it in. Now we've got 5 pieces of information here. So with this 5 pieces of information, I think what I'm going to do is just lump the polys together and then just finish off the card with the abdominal nausea and vomiting and that dehydration and just make 2 cards here. So let's close this off. There we go. That's beautiful. All right, we'll add that in. Now let's make a few more cards just really reminding us of why those things are happening and kind of really honing in on. So let's make one real quick to remind us of the thirst. What term refers to the heightened thirst during hyperglycemia? That's the polydipsia due to all that dehydration. And so we know that metabolic acidosis is taking place. So let's just remind ourselves of why. Why does the body resort to this lipolysis and proteolysis during hyperglycemia? That's because that glucose isn't entering the cells to generate that ATP that generally occurs. We'll make that a card, Control Enter. In the absence of glucose, what metabolic pathway generates fuel for the body, creating a highly acidic environment in the blood? That is that lipolysis. And that's where those fatty acids are getting metabolized into those ketones. That's why we're seeing all those other signs and symptoms along with our hyperglycemia. We've already talked about the polyuria and that highly osmotic glucose that's pulling all the water away from us. So we've got that in there, and that's going to leave us dehydrated. Moving on to our last slide in the clinical manifestations is the ketones. All right, we'll just add one quick last card here. When conducting a urine analysis on clients with hyperglycemia, what will be detectable due to the utilization of lipolysis for energy? Put that in red. And that'll be none other than ketones, and specifically positive in our test. And we'll double click, Control-Shift-C. All right, and now we'll add that in. Now that will be our last card for part 2 of our series. Now we're up to 74 cards in our diabetes mellitus deck that we've went through. And then also we have our beautiful mind map that is coming along just nicely. And now we have a very nice view of our hypo and hyperglycemia clinical manifestations. Now to wrap up our cards here for part 2, I want to go ahead and add in the mind map that we've made throughout this video to the bottom of all the cards we've just made. That way when we flip and see the back side again, we can see this beautiful map that we've made, and we'll be able to envision all the different connections we were working through and crystallize that knowledge just a bit further. So let me go ahead and take a screenshot here of our map. That'll be good. We'll come to the browse function, and I'll fast forward through this for y'all, but I'll just show you that I'm going to look for our cards that we've made today. All right, there you have it. Well, we've added that mind map into the back side of our cards. That way we're going to be able to visualize that map when we're going through and testing ourselves in that active recall session. In conclusion, mastering the intricate details of hyper and hypoglycemia is not just a necessity for nursing students, it's a vital skill that can transform patient care. By understanding the nuances of these conditions, healthcare professionals can respond swiftly and effectively, ensuring the well-being of their patient. We've explored the world of hypoglycemia, where the body's intricate mechanisms attempt to rectify plummeting blood glucose levels. We've covered everything from the initial drop triggering a cascade of responses involving glucagon and adrenaline, all the way to the telltale signs like confusion and extreme hunger. Moving on to hyperglycemia. We've looked at hyperglycemia from the dry flushed appearance all the way to the physiological processes involving osmoreceptors and the body's shift to alternative metabolic pathways. Remember, this knowledge is not just theoretical. It's practical wisdom that can save lives. Whether you're a nurse or not, this understanding equips you with the tools to recognize, respond, and provide the best possible care to those affected by diabetes mellitus. All right, well that wraps up part 2 of the series. You're doing awesome and keep up the good work. As always, if you're finding these videos helpful with your studies, be sure to like and subscribe, and also share with a classmate. And I'll see you in that next video.